Hey everyone, welcome back. We're diving deep into mental health today.
It's a topic that deserves so much attention.
Really is, and it's awesome to see so many of you are interested in really understanding this stuff.
Yeah, there's a real hunger for solid information out there.
Definitely. We've got a ton of research here, a whole bunch of articles, studies, and expert opinions.
Really gives us a broad perspective, doesn't it?
For sure. So basically, we're going to try to break down what mental health really is, why it matters so much.
And honestly, some of the stuff we found is pretty surprising, even to me.
Yeah, I had some aha moments myself, for sure.
So, should we just jump right in?
Absolutely. Let's start with the basics. What exactly are we talking about when we say mental health?
Well, it's not just about, feeling happy all the time, right?
Right.
It's so much bigger than that.
The research we have here points to three main aspects. It's about emotional well-being, psychological well-being.
And social well-being.
It's like a three-legged stool.
I like that. You need all three legs for it to stand strong.
Exactly. So emotionally, it's about being able to manage your feelings,
To cope with stress.
bouncing back from tough times.
Yeah, the resilience is key.
Totally. And psychologically, it's about having clear thinking, a positive self-image.
That solid self-esteem
Yeah, knowing your worth.
and feeling good about yourself.
And then there's the social side of things,
Building and maintaining those strong, healthy relationships.
being able to communicate well.
Feeling connected to your community, like you belong.
So it's not just what's going on inside our heads.
It's how we interact with the world around us, too.
Exactly. And what's really interesting is that all these pieces are connected.
They really influence each other.
I was reading about how strong social connections can actually boost your ability to handle stress.
It's true. Having that support system makes a huge difference.
It's like having a team in your corner.
Exactly. And speaking of challenges, our research also dives into the whole spectrum of mental health disorders.
Yeah, where things go beyond just the usual ups and downs.
When those challenges become really persistent.
Or start interfering with your daily life.
Exactly. That's when it's important to pay attention.
We've got information here on a whole range of conditions.
Anxiety disorders seem to be really common these days.
Yeah, I've heard that too.
So basically, anxiety disorders are all about excessive worry,
Fear, nervousness.
that kind of thing.
But there are actually different types of anxiety disorders, right?
Yeah, like generalized anxiety disorder, that's the one where you're kind of worrying about everything all the time.
Oh, I know that feeling.
Right. It's
Yeah.
like a constant background hum of worry.
And then there's panic disorder, which is totally different.
Yeah, those are the folks who get those sudden, really intense bursts of fear.
Like panic attacks, right?
Exact
Right.
fear. And then there's social anxiety disorder, where the fear is more specific to social situations.
So like public speaking or meeting new people.
Exactly. It's all anxiety, but it manifests in different ways.
Makes sense.
And we also have a bunch of research on depressive disorders.
Okay, so what are the key features of those?
Well, the main thing is this prolonged sadness.
A sense of hopelessness, like nothing matters.
And losing interest in things you used to enjoy.
So we're talking major depression here, right?
Yep,
Which can be really debilitating.
it is.
And then there's bipolar disorder, where it's not just down, it's those intense highs and lows.
The mood swings are really extreme with bipolar.
Interesting. So mental health conditions are not always as black and white as people might.
Not at all. It's a lot more nuanced.
Our research also mentions obsessive compulsive disorder, or OCD.
And sometimes people don't really understand that one.
Yeah, I used to think it was just about being neat and tidy.
Right. But it's way more than that.
So what's the real deal with OCD?
Well, it involves these intrusive thoughts, which are called obsessions.
Okay.
And then people develop these compulsive behaviors to try to reduce the anxiety caused by those thoughts.
So it's like a cycle.
It is, and it can be really hard to break.
The research gave the example of excessive hand washing.
Or having to check things over and over again.
I see.
It's all about trying to control the anxiety, but it ends up controlling you.
Right. And then we have post-traumatic stress disorder, or PTSD.
Yeah, that one is often misunderstood too.
So tell me, what does the research say about PTSD?
Well, it can develop after experiencing or witnessing something really traumatic.
Like a car accident or violence.
Right. Any kind of event that's really disturbing.
And it can lead to flashbacks, nightmares.
Anxiety, emotional numbness, even avoiding things that remind you of the trauma.
It's like the trauma gets stuck with you.
In a way, yeah. The brain's trying to cope, but it can get stuck in that survival mode.
And then we have eating disorders, which, to be honest, I used to have some pretty simplistic ideas about.
Yeah, a lot of people do.
I thought it was all about vanity, wanting to be thin.
But it's so much deeper than that.
So what's the reality here?
Eating disorders are serious mental illnesses.
They involve this really unhealthy relationship with food,
Weight and body image.
like anorexia, where people restrict their eating so severely,
Right, and bulimia, which is the one with cycles of binge eating and then purging.
like making themselves throw up.
Yeah, or using laxatives, exercising excessively.
Wow, that's intense.
It is.
And then there's binge eating disorder, where it's just the binging without the purging.
Right. But again, it's about feeling out of control around food.
So it's not just a diet gone wrong, it's a whole mental health thing.
Absolutely. And it can be really dangerous, both physically and mentally.
Makes you realize how complex this all is.
For sure.
Okay, and then moving on, what about psychotic disorders? What did the research say about those?
Well, schizophrenia is a key example there.
Okay, and what exactly is schizophrenia?
It's a chronic mental illness that affects a person's thinking.
Their emotions, their behavior,
They might have hallucinations.
like seeing or hearing things that aren't there.
Right.
And delusions, which are like false beliefs.
Exactly. And their thinking can be disorganized, making it hard to follow conversations or express themselves clearly.
Wow, that sounds really tough.
It is. But it's important to remember that people with schizophrenia are not inherently violent or dangerous, which is a common misconception.
It's so important to challenge those stereotypes.
It really is. They deserve understanding and support, just like anyone else.
Absolutely. We also found some info on neurodevelopmental disorders, like autism spectrum disorder and ADHD,
Yeah, those typically show up during childhood.
and they affect how kids develop.
Cognitively, socially, emotionally.
So with autism, the main things are difficulties with social interaction.
Communication, and sometimes they have these repetitive behaviors.
And ADHD is more about inattention, being hyperactive, being impulsive.
Right, but it's important to remember that everyone experiences these conditions differently.
It's a spectrum, not a one-size-fits-all thing.
Exactly. And lastly, we have personality disorders.
Okay, what's the gist of those?
Well, these are long-term patterns of thinking, feeling, and behaving that are really different from what's considered normal. And these patterns can cause a lot of problems in their relationships, at work, in their lives in general.
So it's like their personality gets in the way of them functioning well.
In a way, yeah.
Wow, that was a lot. So many different types of mental health conditions.
It is a lot, but hopefully it gives folks a better sense of the range of challenges people face.
Definitely. And I think what's striking is how diverse these conditions are.
They really are.
They affect people in so many different ways.
Yeah, it's not a one-size-fits-all thing at all.
Makes you realize how important it is to understand the nuances, right?
Absolutely. And speaking of understanding, we also dove into the research on what causes these conditions in the first place.
That seems like a big question.
It is, and it's not a simple answer either.
So, spill the beans. What did you learn?
Well, it seems like it's a mix of nature and nurture, you know?
Ah, that classic debate.
Right. Genes and environment both play a role.
Okay, let's break that down a bit.
All right, so first there's genetics.
Meaning family history can increase your risk of developing certain conditions.
It can, but it's not like a guarantee.
So it's not like you inherit mental illness directly from your parents.
Not exactly. It's more like having a predisposition.
Ah, so it's like you're more likely to get it, but it's not a sure thing.
Right. Genes might load the gun, but the environment pulls the trigger, as they say.
I like that analogy. So the environment plays a huge role too.
A huge role.
Okay, and what about the brain stuff? I remember reading about brain chemistry and how that can be involved.
Yeah, so neurotransmitters are those chemical messengers in your brain.
Right.
And imbalances in those can contribute to mental health issues.
So if someone has low levels of serotonin, which is linked to mood, they might be more prone to depression?
That's the basic idea, yeah.
But I'm guessing it's more complicated than just one chemical being off.
Oh, way more complicated. It's a whole network of interactions in there.
So it's like a delicate ecosystem.
Exactly. And then, of course, we have to factor in those life experiences.
The environmental stuff we talked about earlier.
Right, all the things that shake us.
So trauma, abuse, or major losses can really impact mental health.
They can.
But it's not just negative experiences, right?
Right. Positive experiences can be protective, you know?
Like having a supportive family.
Exactly. Or a nurturing environment where you feel safe and loved.
It's like building resilience, giving you the tools to cope with challenges.
For sure.
And speaking of support, social connections seem to be a huge factor.
Huge. Feeling loved and connected to others acts as a buffer against stress.
It's like having a safety net.
Exactly.
And we can't forget about the mind-body connection.
Oh, that's crucial.
Our physical health really affects our mental well-being, doesn't it?
It does. Chronic illnesses, lack of sleep, Even what you eat, it all plays a role.
Makes you realize how interconnected everything is.
It really is. All these factors, genes, brain chemistry, experiences, social connections, physical health, they all weave together.
To create this amazing tapestry of our mental landscape.
Beautifully put. And speaking of landscapes, let's shift gears a bit.
Okay, where are we headed now?
Well, now that we've covered the basics of mental health and some of the challenges people face,
Yeah.
I think it's important to talk about how to recognize when someone might be struggling.
Recognizing the signs.
Exactly. Because knowing the signs is often the first step towards getting help.
It's like those warning lights on your car dashboard, right?
Exactly. They're telling you something needs attention.
Okay, so what are some of the signs we should be looking for?
Well, keep in mind, these aren't a diagnosis.
Right, just red flag.
Right. But if you see these things happening, it might be a good idea to reach out for professional help.
Got it. So what are we looking for?
Well, persistent sadness or depression is a pretty obvious one,
Okay.
but also excessive worry or anxiety.
When it seems out of proportion to the situation.
Right. Like if someone's freaking out over something really minor.
Got it.
And sometimes it's not about the mood itself, but changes in behavior, mood, or energy levels.
So like someone who's usually outgoing suddenly becoming withdrawn.
Exactly.
Or someone who's usually calm getting really irritable.
Yep. Those shifts in behavior can be a clue.
And then there's a whole withdrawal thing, right?
Yeah, when someone starts isolating themselves,
Not wanting to do the things they used to enjoy.
losing interest in their hobbies, spending less time with friends and family.
It's like they're losing that spark.
It is. And sometimes it shows up in their thinking.
Like having trouble concentrating.
Yeah, or having difficulty making decisions.
Even simple decisions.
Even simple ones. Mental health challenges can really fog up your thinking.
And then there are the physical symptoms that people often overlook.
Oh, those are sneaky.
Like headaches, stomach.
Trouble sleeping, changes in appetite.
It's like our bodies are trying to tell us something.
They are. They're sending those smoke signals.
So we got to pay attention to those signals.
For sure. And then there are the more serious signs, like feelings of hopelessness, worthlessness, or thoughts of self-harm or suicide.
Okay, that's heavy stuff.
It is, but it's important to talk about it.
Because if someone is experiencing those things, they need help immediately.
Absolutely. They need to reach out to a crisis hotline, a
Yeah.
mental health professional, or go to the emergency room.
Right, no shame in asking for help in a crisis.
Not at all.
But I'm curious, you mentioned earlier that everyone experiences ups and downs.
We do.
So how do we know when it's just a normal thing versus something we should be concerned about?
That's a great question. I'm glad you asked. Well, it's all about the persistence and the intensity, you know?
Okay.
Like if those signs are happening a lot
Right.
and they feel really intense,
Okay.
or they're just sticking around for a while, like weeks or months,
Yeah.
that's when it's definitely a good idea to talk to a professional.
So just having a bad day or a stressful week doesn't mean you have a mental illness,
No, not at all. We all have those.
right?
It's about patterns and severity, really.
Gotcha. So if you're constantly feeling overwhelmed,
Yeah.
or you notice these big changes in your thoughts or feelings or behaviors.
Then it's time to reach out for help.
Makes sense.
It can really make a difference.
Okay, so now that we've talked about the signs to watch out for,
Yeah.
I'm curious, like why does all this mental health stuff matter so much?
Good question.
Beyond just, feeling good.
Right. Right.
It seems like it affects so much more than that.
It totally does. It's like, think about your relationships.
Oh, yeah, for sure.
Mental health plays a huge role in how we connect with other people.
Makes sense.
Family, friends, partners, even coworkers.
It's all connected.
It is. I can imagine if you're dealing with anxiety or depression, it can be hard to be fully present in those relationships.
Yes, that makes sense.
You might have trouble communicating or regulating your emotions.
Okay.
It can even affect how well you can empathize with others.
So it's like mental health challenges can create these barriers
They can.
between you and the people you care about.
Yeah. And on the flip side, having healthy relationships can be so good for your mental well-being.
It's like a positive feedback loop.
It is. Feeling loved and supported can make a world of difference.
I could see that. And the research also talked about how mental health affects our work lives.
Oh, big time.
Yeah. I mean, it makes sense.
It does.
If you're struggling with your mental health,
Mm-hmm.
it's going to impact your concentration, your motivation,
Culture.
your ability to make decisions, even how you handle stress.
All those things are crucial for work, right?
Totally.
Yeah.
And then there's the whole issue of like a stressful work environment can actually make mental health problems worse.
Oh, yeah, it's a vicious cycle.
It is. So it's like a two-way street.
It is, and that's why it's so important for workplaces to be supportive.
Right, to create environments where people feel safe to talk about these things.
Exactly. It benefits everyone in the end.
Happier employees, more productive work environment.
For sure.
Okay, we touched on this before, but the mind-body connection really stood out to me in the research.
Oh, yeah, that's a powerful one.
Like, we often think of stress as just this mental or emotional thing,
Right.
but it can manifest physically, too.
Totally. Think about it. You know when you have a deadline coming up and you get
Mhm.
that pension headache?
Oh, yeah, all the time.
Right. That's your body responding to stress.
And I read that chronic stress can actually suppress your immune system.
It can, which makes you more likely to get sick.
Wow. That's wild.
It is. And then there are more serious links too, like depression being linked to heart disease.
Really?
Yeah, and other chronic illnesses.
So it's not just about feeling good, it's about our physical health, too.
Exactly. Taking care of your mental health is an investment in your overall well-being.
Makes sense.
It's like taking care of your car, you know?
Okay.
If you don't do regular maintenance,
Mm-hmm.
it's going to break down eventually.
Right, right.
Same with our mental health.
Gotcha. And ultimately, good mental health just makes life better, doesn't it?
It does. It helps you manage stress,
Mm-hmm.
build strong relationships, achieve your goals.
Okay.
You know, just enjoy life more.
It's like having a solid foundation.
It is a foundation for a happy and fulfilling life.
Totally.
Yeah.
Okay, so let's say someone is struggling.
Mm-hmm.
What are some ways to find support and treatment?
Well, the good news is there are a lot of options out there.
Oh, good.
And recovery is definitely possible.
That's encouraging.
It is. It's about finding what works best for you.
Okay, so what are some of the options?
Well, one thing that came up a lot in the research is psychotherapy or talk therapy.
Okay, so basically talking to a therapist.
Exactly. It can be one-on-one
Mhm.
or in a group setting.
Okay,
And it helps you understand your thoughts and feelings, develop coping skills,
got it.
learn how to manage stress.
Right, right.
And
Yeah.
sometimes just talking things through with someone can make a world of difference.
Yeah, it can be really helpful to have that objective perspective.
It can. And there are different types of therapy too, like cognitive behavioral therapy or CBT.
Oh, I've heard of that one.
Yeah, it's pretty popular.
What's the main idea behind CBT?
It's all about identifying those negative thought patterns and behaviors
Okay.
and learning how to change them.
So like if you tend to think negative thoughts,
Mm-hmm.
CBT can help you reframe those thoughts.
Exactly. And then there's dialectical behavior therapy or DBT.
Okay, what's that one all about?
It's really good for people who struggle with regulating their emotions.
So like if you get overwhelmed easily.
Yeah, or have trouble dealing with intense emotions.
Got it.
It teaches you skills to manage those emotions and cope with distress.
Sounds helpful.
It is.
Yeah.
And then there's psychodynamic therapy, which is more about digging into your past.
Like childhood experiences.
Exactly, to see how they might be affecting you now.
Interesting.
It is. It's all about uncovering those unconscious patterns that might be driving your behaviors.
Wow, that's deep.
It is. But sometimes therapy alone isn't enough,
Okay.
and medication might be helpful,
Yeah, the research mentioned that.
like antidepressants, antipsychotics, mood stabilizers, things like that.
Okay.
They can be really effective for managing symptoms.
Of certain conditions like depression or anxiety.
Right. But of course, any medication should be prescribed and monitored by a doctor.
Of course, always good to have professional guidance.
Always. And then, beyond therapy and medication,
Hmm.
there are things like support groups.
Oh, yeah. Those can be valuable.
They are. They give you a sense of community.
Right, like you're not alone in this.
Exactly. It can be so validating to connect with people who understand what you're going through.
Yeah, it's like finding your tribe.
It is, and those connections can be a huge source of hope and support.
For sure. And then there's the whole self-care and lifestyle changes thing.
Oh, yeah. Those are things we can all do.
Right, whether we're struggling or not.
Exactly. Things like getting enough sleep, eating a healthy diet, exercising regularly,
Okay.
and managing stress.
So it's like building healthy habits to support our mental well-being.
It is. It's like preventative maintenance for your mental health.
I like that. But what about when someone is in a real crisis?
Like they're having thoughts of harming themselves.
Yeah, or they're just totally overwhelmed and don't know what to do.
That's a serious situation.
It is.
And that's when crisis intervention is crucial.
Okay, so what does that involve?
It means getting immediate help from emergency services
Okay.
or calling a crisis hotline.
Got it.
or going to a mental health facility.
So there are options for immediate support.
There are. And it's really important to know that there's no shame in reaching out during a crisis.
None at all. It's actually a sign of strength, asking for help when you need it.
Totally agree.
Right.
But even with all these resources,
Mm-hmm.
there's still so much stigma surrounding mental health.
Yeah, that's a big issue.
It is. And it prevents people from getting the help they need.
How so?
Well, it makes people feel ashamed,
Right.
like they're weak or flawed,
Right.
so they keep their struggles hidden.
And suffer in silence.
Exactly. And that's the opposite of what we want.
We need to break down those barriers.
We do. We need to normalize talking about mental health.
Yeah, make it okay to not be okay.
Exactly. So how do we do that?
Good question. What did the research say?
Well, one big thing is just talking about it more openly.
So like having these conversations?
Yep. Sharing our own experiences.
Okay.
Being supportive when others share theirs.
Right, creating a culture where it's okay to talk about mental health.
Exactly.
Yeah.
And challenging those stereotypes and misconceptions.
Like the idea that people with mental health conditions are somehow dangerous.
Right. Or that they're just lazy or making it up.
Those are harmful stereotypes.
They are. We need to remember that mental illness is just like any other illness.
Right, it's not a choice.
It's not. It's something that people experience, and they need support and understanding.
Totally. And we all have mental health, just like we have physical health.
Exactly. And sometimes we need a little extra help to take care of it.
Absolutely. So to all our listeners out there, if you're struggling, please know that you're not alone
There are people who care.
and there's help available.
Recovery is possible.
Don't let shame or fear stop you from reaching out.
There are resources. There are people who want to help.
And even if you're not struggling personally,
Hmm.
you can still play a role in breaking down stigma.
Totally. Be a supportive friend, family member, colleague.
Okay.
Listen without judgment. Offer encouragement. Help people connect with resources.
Even small acts of kindness can make a difference.
They can. It's all about creating a more inclusive and compassionate world.
Where mental health is valued and prioritized.
Couldn't say it better myself. Now, as we wrap up this part of our deep dive, I'm curious, what's resonating with you the most from all this information?
Yeah, what's really standing out to you? It's honestly a lot to take in,
I know, right?
but it's fascinating stuff.
It really is.
I knew mental health was important,
Mhm.
but I didn't realize how much it impacts like every single part of our lives.
It's true. It affects everything.
Our relationships, our work, our physical health.
Our overall well-being.
It's like this whole interconnected web.
It is. And we've really only scratched the surface here.
Yeah, we have.
I mean, each of these disorders we talked about,
Right.
the things that influence well-being, the different treatment approaches,
Mhm.
they could all be deep dives on their own, honestly.
Totally. It's like we open this door and there's this whole world to explore.
Exactly. And it's a world worth exploring.
For sure.
The more we understand about mental health, the better we can take care of ourselves,
right.
support the people we care about,
Right.
and create communities that are really inclusive and compassionate.
That's a great point.
It is. And this deep dive, it's given us a good foundation.
It has.
But like I said, there's always more to learn.
Always.
Bro.
So as we wrap things up here,
Yeah.
I want to leave our listeners with something to think about.
I love that. A little food for thought.
Exactly.
Yeah.
So after learning all about mental health today, what's one small step you can take
Okay.
to prioritize your own well-being
Good question.
or to support someone you care about?
It could be anything, really.
Yeah.
Like checking in on a friend, seeing how they're doing.
Right.
Or maybe taking a few minutes to practice some mindfulness.
Like meditation.
Yeah, or just some deep breathing.
Okay.
Or even just learning a little bit more about a specific mental health topic that interests you.
Right. Keep the learning going
Exactly. The key is to take action no matter how small.
because even small steps can make a difference.
They can. They really can.
And remember, you're not alone in this.
Never forget that.
There are resources out there. There are people who care.
And there's a whole movement growing to make mental health a priority.
So keep learning, keep connecting, keep advocating.
Yes. For a world where everyone feels supported and empowered to take care of their mental health.
Love that.
Mm.
Well, that brings us to the end of our deep dive into the world of mental health.
It's been an amazing journey.
It really has. Thank you so much for joining us.
And thank you for having me. It's been a pleasure.
Until next time, everyone, take care and be well.